Okay, hi everybody. I'm Bob Friedberg from Palo Alto University, where I'm a professor and head of the pediatric behavioral health. That we're going to talk about today how to decide whether it's worry versus anxiety during these very strange days of the pandemic. So here are the objectives for today. First is to recognize that worry during the pandemic is normal and universal. Second, to understand the difference between worry, anxiety, and fear. And then third, become more familiar with valuable resources for coping with worry, anxiety, and fears. So let's do it. We are living in strange days. And they're strange days because objectively, there's danger out there. And it's real danger. So when we're presented with real danger, worry is the new normal, and it's not unusual.
It's not unusual to be loved by anyone. It's not unusual to have fun with anyone. But when I see you hanging about with anyone, it's not unusual. It happens every day.
So everybody's worrying now. Everybody's looking around, looking for signs of danger, wanting to make sure they can avoid danger, and trying to keep themselves safe. And that's normal. Because worry is normal. And what is it? It's the cognitive process, or the way in which information's handled, that prepares you to anticipate true danger. The key word, or the key phrase there, is it prepares you to anticipate true danger. Preparation and of true danger. In that way, worrying serves survival. The biologist Lewis Thomas very famously noted in a wonderful book called The Lives of a Cell that evolution favors worriers. Those people who were worried about going out in the dark without fire and falling into a deep hole or off a cliff due to the darkness stayed in their cave. They survived. That was a true worry. It served survival. However, when worrying becomes uncontrollable and fails to anticipate true dangers, that's when you get things like anxiety and fear. And those things are not universal nor normal. So when we talk about anxiety, anxiety is the sense of intense, uncontrollable, disabling worry that does not anticipate true dangers. Aaron Beck, a famous psychiatrist who won the Lasker Prize several years ago, described anxiety in a very nice way. And that is that in anxiety, the alarm is worse than the real fire. So anxiety is different from worry because it's an intense fear reaction in the absence of true threat. And it's disabling and uncontrollable. It often leads or accompanies a fear response. And the fear response is freezing or withdrawing or hiding under the covers like that cartoon image on the screen. That you freeze to avoid impending threat or to escape danger. But fearfulness, in the absence of true threat, compromises problem solving and adaptation. So the key part in determining anxiety versus fear versus worry is that anxiety is a common process that prepares you to adapt and problem solve when true danger exists. Fear and anxiety are extreme reactions where your problem solving and your coping capacity diminish, they get less when there is objectively not a very strong threat. So what happens when we're fearful and anxious? We have types of responses that don't work well for us. We kind of retreat into our shell, or we ignore things and pretend they're not exist, and we avoid them. So you're kind of like the turtle or the two figures on the screen where you just block everything out and say, no, this is too much. I can't deal with it. So all three of these things, worry, anxiety, and fear, have common thoughts that go with them. And these common thoughts can be seen as mental packages about yourself, about others, and the world around you. I'm fragile. I'm unable to cope. Others are better at it than me. Others are dangerous. The world is filled with many, many threats and contaminants. And these things are beliefs, images, judgments, predictions, conclusions that run through people's heads. They vary on a scale from low to high. So low ones, like the little bubbles going up on your screen, they're not very problematic. And everybody sometimes worries that they're vulnerable. And everybody sometimes has a mild sense maybe that the world is a dangerous place. But when kids and adults get worried and it gets uncontrollable and anxiety ensues, these things, these beliefs or images, rise up to the top of the scale and they become very severe and intense. When you have these thoughts, these mental packages, they tend to center around two really important themes in anxiety and fear. And these themes are danger and uncontrollability. That we become extraordinarily watchful about the dangers that may occur. And we worry that we can't control things. And you can see that this pandemic that's happening taps both of these themes. There is quite an element of danger and also a large degree of uncontrollability about what happens. So again, worrying somewhere in the low to middle range is very common, very realistic. Anxiety, once it goes up that scale of those bubbles rising to the top and it becomes intense, disabling, and compromises your problem solving and adaptability, then it becomes a problem. So, the danger part. The danger part worsens when you pay too much attention to threat and danger. And that's, if you remember the meerkat in the screen several slides before, that's what the meerkat's doing. He's looking around, looking for those marks of danger to make sure he doesn't miss any of them. The technical term to that is being hypervigilant, that you're looking for any possible sign that danger occurs. And hypervigilance does have a function, right? Is that it's trying to help you survive. But remember, the key word of that is hyper. That it's important to be vigilant, but when you get hyper or too much vigilance, that's when anxiety and fear take over. And when you have this anxiety, that's marked by hypervigilance, you start to confuse what's possible, what may happen, versus with what will happen. So yes, there is a threat of death, of dying from coronavirus. However, that's a possibility, scary possibility, but a possibility. However, it's a low probability. It doesn't affect the vast majority of people who get the illness. So therefore, the risk when you're becoming anxious and hypervigilant is magnified and multiplied beyond what is reasonable. So you should be vigilant, but you don't want to be hypervigilant. Anxiety and fear are marked by catastrophizing. Worry doesn't have catastrophizing. Anxiety and fear have that as a common characteristic. And when you catastrophize, you do what that cartoon does, and you think, what if this happens? What if that happens? And your answer is, well, what if that happens is that it's the worst thing that can happen. That the absolute worst, horrible, catastrophic thing can happen. And then you can start to confuse that catastrophe with being possible rather than potentially probable. This is a big one for anxiety and fears in general, and in particularly now in the midst of these strange days of the pandemic, is that anxiety and fear have as a central component perceptions of uncontrollability. And again, if you're anything like me, you like to be in control. That's normal. But these things around the pandemic are all out of control, right? It's, as many people you hear on the news, that they talk about it as being invisible. And it's called the novel coronavirus because it's new. And so we don't know everything that we probably do need to know about this. So there's a lot of uncontrollability about it. We don't control when the travel restrictions and movement restrictions will come on or be lifted. We don't have control over a lot of things. So if you're vulnerable to situations that you can't control and they make you very, very nervous, anything like a pandemic or any other event that's uncontrollable makes this all worse. So if you're at a starting point of low, let's say on that little bubble thermometer that you saw on the slides a few slides ago, it pumps you up because you already have this sort of vulnerability that I don't like and I feel uncomfortable in situations I can't control. And then all your anxiety and fear starts to bubble up. Another common thing in anxiety and fear, and not in worry, is so you're confusing possible with probable. You're worried that the most catastrophic outcome could occur, and you believe you're completely out of control of everything. And then that gets coupled with a sense that there's nothing I can do to cope. I neglect my coping factors. And that also makes things worse, right? And that's when worry becomes fear and anxiety. So what to do, to think about as to whether you're actually having a typical reaction to a very atypical, uncommon, and again, everybody's using the words unprecedented, once in a lifetime. Let's hope it's once in a lifetime event. are these several very simple factors that we as professionals do all the time, but you at home can check them on yourselves. First, just like if you have a physical condition, if you have a pre-existing emotional or psychiatric or psychological condition, that's going to be worsened by something like this. So if you see the fact that if, let's say, you have something that we call obsessive compulsive disorder, where you do a lot of hand washing or checking regarding contamination sometimes, if you see that worsening, then it's something that you may need to take care of with some professional intervention. Same type of thing is that if you notice your child who might have social anxieties or something called general anxieties, which is anxieties about a whole lot of things, and they're just floating around and they're worried about the world, their health, school, etc. And all of those things start to be worse since our stay-at-home orders and the pandemic persists. That's something, again, that you may need to manage either on your own, or if it gets too hard for you, with professional help. Second is there a change from previous behaviors? As I previously mentioned, just to tell you, is that I'm not crazy about uncontrollable situations, right? I get a little uncomfortable about them even before we even had this pandemic. But is my behavior changing as a function of what's going on? And is it worsening my worries about control to the point where I'm getting very, very anxious? 1 and 3 ways to take a look at whether you or your children or your other adult loved ones are sort of changing from just typical worry that we're all feeling to an anxiety or fear response is, one is, how often are you having these problematic thoughts, feelings, and behaviors? How intense are they? How bad are they? How much are they impairing or disrupting your life? And third is, how long have this been going on? Has it been going on just since this morning, since yesterday, for a week, for several weeks, etc.? To the extent that it's become very frequent and very intense and lasting a long time, then that's something, again, that you want to address. Now we're going to do a second webinar on with coping skills. And I'm going to cope by telling you this slide. I'm just going to cover the coping strategies very, very briefly. And so, yeah, we're in the midst of quite an event. No one chose to have this, right? But you don't have to be a superhero to cope. There's some simple things you can do. You can be what Steve Hayes calls an ordinary hero. Steve Hayes is a remarkable and legendary clinical psychologist who has developed a number of different self-help books. And most importantly, during this period of time, he published a blog or an article that I have put the link up there that talks about how you can be an ordinary hero during these crisis times. And what does he mean by the things you can do to be an ordinary hero? Well, you're going to be probably very familiar with the next slide. Is that what we need right now is lots and lots of ordinary heroes. We have some superheroes out there that are delivering packages and staffing grocery stores and pharmacies and delivering food and taking care of patients in hospitals and clinics. Those are our superheroes. For many of us, we can still be a hero, but kind of being an ordinary hero and being a support for them. And these are not things, throwaway things. By doing these things from the CDC, you can be a hero. And those things are the things that you've probably seen in the papers, on the internet, and on TV, is wash your hands with soap and water for at least 20 to 30 seconds. Avoid touching your eyes, nose, and mouth with unwashed hands. Stay home. Cover your cough or sneeze with a tissue, or throw the tissue in the trash, or cough or sneeze into your elbow. Keep your social distance. And if you have to go outside, wear a cloth mask. These are not throwaway things. If we all follow these, it's heroic, and we can flatten the curve. So that's one basic thing that everyone can do. You don't need special skills to do that. But when you do that, you're being heroic. And if you need even more inspiration to do that, check out the link on the slide. Then you can make use of some self-management strategies. Problem solving, which we'll talk about in a subsequent webinar. How to re-engineer those anxious thoughts that may be going through your head, where you are catastrophizing or confusing possible with probable, catastrophizing, or trying to control things that are uncontrollable. You can practice relaxation, mindfulness, meditation, and you can stay engaged in pleasant activities. Those are some basic self-management strategies that probably you already know how to do, or that you have done in the past and just haven't done in most recently, and you just have to re-exercise those muscles. And in our next webinar, we'll talk about some exercises that you can do at home to help you exercise those muscles so that you can be better self-managers. Fortunately, lots of people are developing great resources. And on these next couple of pages, I have some resources that are just amazing. And they're engaging, they're brief, they're short. They have the links. I would encourage you, again, as a great problem-solving strategy, to go to really trusted resources like these from the American Psychological Association, the Division of Child and Adolescent Psychology, from the American Academy of Child and Adolescent Psychiatry, from Columbia Department of Psychiatry, which has a great page. One, it gives you responses to very frequently asked questions, and another page and menu item is coping, with a ton of coping resources there. The Anxiety Depression Association of America has both text materials and instructional videos on coping skills with that address. Bill Sanderson from Hofstra University, who runs their anxiety and depression clinic, has 2 sites that are just robust, filled, and with rich, useful, practical information on how to understand anxiety and how to cope with it. And this is a very broad and amazingly comprehensive site where multiple agencies, organizations, academic institutions have pulled their resources together on one platform with videos, text material, coping tips to help you deal with these type of things. The UCLA has contributed to that. The Department of Veteran Affairs, healthcare providers, and patient advocacy organizations have all teamed up to give you the best of their knowledge on how to understand what's going on emotionally and how to deal with it. If your child, is experiencing some anxiety, there are a couple of terrific parenting books. Tamar Chansky's Freeing Your Child from Anxiety, Help for Worried Kids by Cynthia Last. Those are books that I give to parents all the time to help them understand anxiety and to give them useful, tractionable, practical tips on how to help their kids through anxious and fearful times. They are absolutely terrific. You can get them on Amazon. If you go on Amazon, they're relatively inexpensive. I think I saw one of them for $1.99 from one of the sellers. So these are just great resources. And there's even a self-help guide for teens who are experiencing anxiety and fear called My Anxious Mind by Michael Tompkins. Terrific book, engaging, lots of understandable, interesting, and compelling techniques and exercises for kids to use their coping muscles so they can manage anxiety and panic. Now, I've given you some tips that you can do on your own. Now, sometimes worries become anxiety and fears, and they become very disruptive, distressing, and impairing. If that's the case, contact your trusted health provider. There are telemental healths are becoming widely available. If you don't have an existing health provider or therapist who has telemental health capability, our local counties operate crisis lines. And you can see them there on this slide. And if somehow you're not in those two counties, there's a national helpline that you can call. And of course, if you need urgent care, you can always dial 911. So I'm almost out of time. I've really appreciated you taking the time to learn a little bit about anxiety, fears, and worries, and how to see the differences between them, and what to do if they're bothersome. But before we end, I want to reiterate that remember to try to be an ordinary hero and do those things that are on the screen. We'll be back with another webinar on coping in a short period of time. Stay healthy, stay well, and stay home if you can. Thanks very much, and be well.